Greetings, everyone. Dr. Melanie Kreitz-Bachert here with 360 Pelvic Health Institute in Portland, Oregon, Center for Men's and Women's Urology, back today with another exciting conclusion to our discussions that we've been having. And so I wanted to address some common issues and questions that have been coming in. And so thank you all for participating, and thanks for sending those questions in, because it really gives great material for the next discussion. So I'd like to start out by reading another email that I got, which is very, very pertinent to what we have been discussing and what we can discuss going forward. Dear Dr. Kreitz-Bachert, I've started to see occasional blood in my urine. At first I thought it was a part of menstruation, but it seems to be happening during other parts of my cycle as well. Is this normal? I have no pain, no discomfort, and I'm otherwise healthy. Well, thank you, Jennifer, for that question. So what I would like to say is you addressed the first question that I would have. Is it associated with menstruation, or is it for some other, do you think it's, for some other reason? So what I will tell you, some very common things. First of all, see your gynecologist if you're having irregular bleeding. If your periods are like clockwork and you're on birth control, then yes, absolutely, this may very well be blood in your urine and you need to get this worked up. What I would also say is if you have an IUD, those can cause some irregular bleeding situations. So I would also address that with your gynecologist. As far as whether or not it's blood in urine, so let's assume just everything is negative from a gynecological standpoint, and let's assume that this is in fact blood in your urine. If it is, blood in the urine is not normal. And there are some situations where it runs in families, where families can have what we call benign familial microscopic hematuria. And basically that's where multiple patients, multiple people in the same family go through a workup for blood in the urine, and it's all been completely negative. So let's just say it is blood in the urine. Some things that you would need to do. Of course, see your urologist. The urine will be sent for culture. It may very well be sent for cytology to check for cancer cells. Keep in mind that if you're a smoker, that predisposes you to and makes you higher risk for bladder cancer and other urological cancers. So of course, if for no other reason, but there are many reasons to quit smoking, if you're smoking, that is one reason to stop. The other thing that we would do is imaging studies, which would be a CT scan with dye to basically light up everything from the kidneys all the way down to the bladder to check and make sure that you don't have any stones, that you don't have any tumors, you don't have any strictures, other abnormalities that may be present within the urinary system. And we would also set you up for a cystoscopy, which is a big long word, meaning that we would put the camera inside the bladder and take a look around. So, I hope that answers your question. Generally, in young, healthy individuals, there's something going on. If it is truly blood in the urine, there's generally something going on. If you're seeing frank blood, very likely a stricture or a stone, and yes, you can have kidney stones and not even know that you have them, and you can see blood in the urine as a result. So again, blood in the urine is not normal. It does need to be worked up. Make sure that everything with your cycle and from a gynecological standpoint has been addressed as well, and otherwise talk to your doctor about it. Hope that answers your question. Thanks so much. Keep writing in, everyone. Take care.